Felicia Lester, who's done an amazing amount of work in Uganda, has shown real dedication to long-term collaboration. And thank you so much for coming and offering to share the work you've done through ECSF over the last many years.
Thanks so much, Katrine. I'm very excited to be here to talk to you a little bit about what we've been doing in obstetrics and gynecology. And first off to say, I really think that we are in this together. The very things that we need for obstetrics and gynecology to help improve outcomes at this point are exactly the same things that are needed for ortho and for surgery and for anesthesia and for our emergency medicine colleagues and critical care. And frankly, taking care of sick patients, as Rochelle said, from sepsis to cesareans. It's really the healthcare system. And I think that's probably the biggest challenge that we'll face, but that I think together we really have to hold our partners accountable and ourselves accountable to doing that work and to figuring out how to do that work. So Dr. Ueda is one of the GYN oncologists who's been doing a lot of work and a really wonderful work in training in GYN oncology at Malago. And Meg Autry is our residency director and has been very involved in the work that we've been doing. I want to thank Dr. Judice and the department for supporting the work that we've done, that we've been able to do so far, and to help us move forward with the vision we have for collaboration with all of you here at GHS. I have no disclosures. And this is just to remind us, as has been mentioned before, this work is really about improving the health of people locally and globally, recognizing the disparities that exist and trying to use the skills and the knowledge and the passion that we have to address that. One of the main collaborations I'll be talking about here is our work with Macro University. And our emphasis has been on education and change, capacity building, and clinical research. One of the impetus for doing the work that we do has been the interest of our residents in understanding global health and global OBGYN more, and in being able to have experiences abroad. And although we love that passion, we wanted to think critically about how we can actually harness that passion to try to make a difference and to have there be equitable and ethical exchanges with our learners and help our partners as well. So our vision for this type of academic partnership has really been based on these principles that include capacity building and training of our local partners as well as our residents, and that includes faculty being involved. And faculty being involved is an expense, and that's one of the challenges that we've faced, is how do we support faculty to support our residents and to improve the training of faculty partners abroad and our residents abroad as well. The GPAS collaboration has been an important part of the work that we've done in obstetrics and gynecology. I had known Narup when I was a resident and worked at Malago with him for my 2-month elective at Malago Hospital, and that's what sparked a lot of the interest in this work. And we recognize that some of the same challenges we face in obstetrics and gynecology were faced by surgery and anesthesia. And we also had colleagues in infectious diseases who said, look, you know, at Malago, not only do women have to wait 3 days for an emergency C-section at times, but HIV positive patients who are sick enough to be admitted to the hospital at Malago have an 80% mortality at 6 months. So the very same issues in terms of quality of care that was provided there were affecting our infectious disease colleagues, our surgery colleagues, and our work as well. So I think that collaborations like this can really build the partnership to address issues that affect all of us. So what we've been able to do so far through our collaboration has focused on resident skill building. We've done a lot of simulations for laparoscopy as well as for operative vaginal birth and for things like breech, extraction, and shoulder dystocia. We've also done work in collaboration with anesthesia and using the SIM Center that GPAS has helped support on management of postpartum hemorrhage, which, as many of you know, is one of the major causes of maternal death. And with obstructed labor, probably represents the biggest need that we have in obstetrics and gynecology for surgical training. We've also been involved in clinical teaching, so teaching on the wards and in the ORs, as well as residents who have partnered with Ugandan residents to develop protocols for things like management of preterm premature rupture of membranes, looking at the evidence and how we can implement those evidence-based strategies even in Malago. And we've also mentored many of the MEDs in their research training. For faculty development, the faculty themselves identified several gaps, including laparoscopy, hysteroscopy, cystoscopy, ultrasound, and fetal monitoring. So we've been focusing training in those areas for the faculty. So our faculty go and work side by side with their faculty on the ground to train in those areas. We've also taken after the GPAS model of senior scholars, so we've funded new grads who are going to join the faculty there to be really involved in resident education and to build their skill set in quality improvement research and methodology. And we're very proud that one of our current senior scholars is going to be a GLOCAL fellow next year. And GLOCAL is a wonderful fellowship program headed by Craig Cohen that helps support research training for fellows from the US and from global sites as well. And for GYN oncology, there are no trained GYN oncologists in Uganda. And as was mentioned before, cervical cancer is very prominent in these countries. You'll admit at least 2 women a day presenting with vaginal bleeding, either in postmenopausal or premenopausal, who have an operable cervical cancer. Some cervical cancer requires radiation therapy, but others can be treated with a radical hysterectomy, but the training to do that surgery is not there. So the ward is filled with about 50 to 80 patients on any given day, waiting for radiation or just palliative care. Nobody waiting for surgery until Dr. Bueda started going and training in radical hysterectomy. We're very happy that one faculty took a huge interest in this, and we've been able to support her training in Kenya, so a South-South collaboration. She's going to be the first GYN oncologist in Uganda. So she's returning to Uganda within the year and is going to be working at Malago as a GYN oncologist. Professors of Gynecology and Obstetrics Association in the US, we've done training in remote surgical skills, showing that even mentoring from afar using Skype can help improve knot tying skills. And we've developed a curriculum that I'll talk about a little bit more. UCSF has wonderful family planning fellows, and 3 of our fellows have chosen to go to Malago and to do work on family planning, particularly postpartum contraception and long-acting reversible methods. And we've gotten an NIH grant through Sue Ellen Miller to look at the reintegration of women who've undergone successful fistula surgeries and looking at how they reintegrate into the community. Because as many of you know, fistula is not just a surgical disease, it's often a psychological and has social implications that end up wreaking havoc on people's lives. So the senior scholar I talked about a little bit already, and our UCSF resident experience is something that we think is very unique. We have on-site faculty mentors from UCSF as well as from Malago who will mentor our residents to try to improve the impact they can have, as well as improve the experience that the individual has, and to improve the overall success of the collaboration. We ask our residents to complete a pre-departure curriculum, and this is what we got the APCO grant to create. It looks primarily at clinical scenarios that will either be new to our UCSF residents, because they haven't seen them before, or the very same things we deal with on a daily basis here, but with site-specific management, because the resources are so different. So the curriculum is an iBook as well as being online, and it has 4 different modules that look at global health, underserved women's health in this country, and refugee and immigrant health. So just looking at some of the modules, we had a collaboration with the library to help develop a really beautiful curriculum, and it has self-tests throughout each of the modules. So this is something that we are very proud of and would like to continue to expand on, with the idea that being prepared for your experience abroad can help it be meaningful for you and help you have more of an impact and be less of a drain on the existing system. So we're by no means perfect in this regard. There's a lot of work to be done, and I think we can do this work together. Some of the collaborations that have already existed that we've been very happy to be part of have involved anesthesia, surgery, emergency medicine, critical care, both locally and globally. And I think Molly Cook's group, the Global Health Education Faculty Interest Group, is going to be instrumental in some of the things that I'm very interested in, which is global health education and helping to define best practices so that we can figure out what is the best way to have our learners have meaningful experiences abroad, as well as meet our overall goals of contributing to the training of faculty and residents abroad and actually impacting health. Because I don't think we know how to do that the best way yet, and that's something that's very close to my heart. And I know in all of our departments we have trainees who want to go abroad, do good work, but we don't know how to best incorporate them to a system that may already be struggling. And ACOG, our college at the national level is very interested in global health education and global health now as well. So there's some potential collaboration there. And Fook and Madhavi have been very instrumental in creating the HEAL Fellowship that the internal medicine folks, family medicine, and pediatrics have been doing. And they've recently approached us to look at whether we'd be interested in creating a similar fellowship in obstetrics and gynecology. And I think that would be a wonderful way to continue to collaborate and to support the kind of work that we all want to do here through GHS. Thank you.